how many people we have. I don't know.
Yeah, the broadcast has started and you're
Okay.
live. Yeah.
Okay. So, good morning, good afternoon, and good evening, everyone. I'm Mark Adkins, and I'm your host for our panel discussion today on mission-driven innovation, how product innovators are responding to COVID-19. Before we introduce ourselves, I want to thank personally our sponsor for this session, Phillips, tremendous company, also very active here in the Pittsburgh area. What I'll have us do is briefly go around and just briefly introduce ourselves, and then each of our panelists will have a short talk they'll give in a minute about their personal experience and work in fighting COVID-19 through innovative techniques. I'm Mark Adkins. I'm CEO of LeanMed, and I'm in Pittsburgh, Pennsylvania. Venkadesh?
Hi, good morning, everyone. This is Venkadesh Narayanan, and I am speaking to you from Chennai, India. I'm working as principal consultant for new product developments for Physics Business Consultants Private Limited, and this is my, like, in about couple of months I'm going to finish 30 years in the new product development area. So our company is specializing in the area of new product development consulting and certifications, trainings. I closely work with PDMA USA. And the thing is, like, one of the recent thing, like, we started having the onslaught of, I would say, onslaught of COVID from March end. And now, like, almost 6 months over. And we are seeing a emerging pattern. Like, I would say, I would classify these industries under three categories. Number one, positively affected industries, right? It's good to hear, right? In spite of the COVID problems, positively affected industries. These industries are seeing like something like a 20% growth over their estimated income. Okay, so some criteria. And the negatively affected companies, like compared to their estimate, now they are kind of like doing kind of like below like 20%, or like the drop is more than 20%. Some of these industries are not affected much. When we say not affected much, it is relatively by taking this 20% criteria. And if you take this positively affected companies, if you see like vitamin supplements, one of our client who are like a leading vitamin supplements provider in India and Southeast Asian countries, and they have seen like especially vitamin C and zinc. Okay, it was like going through roof, right? I'm just saying 20%, but they are doing like something 60% growth. Like always, their factory is like running round the clock, no holidays, nothing. Okay, it's going on. And the negatively affected, it's kind of like these are all the group of clients from the tourism and the travel industry. And here like now they are doing I would say like there is a tremendous amount of innovation happening in these companies. One of the reason is like now, like you see, we always see the factors for innovation. Even like now I started believing the way these companies are doing, even threat could be one of innovation is a function of threat. More the threat, we are becoming more innovative, right? Because this company is doing, I'll give you a small example from this company. This is a tourism company. They offer like guided tours in different parts of the world, especially in the Southeast Asian countries, and to a great extent within India. And now this company, what it's doing, like now, like there is nothing kind of like happening in this industry. So this company is like with some technological innovations, they're providing virtual tours. Now, in the past, what they used to do, they they take the people for a physical tour, and those souvenirs are kind of like a virtual, right? They get the photographs and other things in virtual. Now what is happening is the tour is virtual, and they're getting the souvenirs in physical, right? So what they do is like they're providing these guided tours, like virtual tours for children. And for example, like last week, this company did, they kind of like they sent their crew to Lakshadweep. This is one of the group of islands in the southern part of India, and this is a kind of like very popular for coral reefs. And they kind of like completely had a virtual tour, and their major clients are children in the age group of like say 6 to 13 years old. And at the end of this, like what they do is like along with their pictures, they superimpose the nature along with their pictures, and they get a physical souvenir, right? So earlier it was physical, then virtual. Now it is virtual, then like the souvenirs are physical. So
All
this
right.
is kind of like, yeah, please go
Thank
ahead,
you.
Mark.
Yeah, thank you, Venkadesh, for
Yeah.
that introduction. Also, before we, again, what I'd like to do is just go around briefly and introduce who you are, and then we'll come back to the individual stories. The other thing that I wanted to do, we have the Q&A line. I want folks to be aware that while our panelists are talking, please feel free to submit questions into the Q&A. We're going to spend the first half of our session with individual stories from our panelists, and plan to have the second half of our time available for Q&A. So please feel free. I'll be monitoring the question queue. And then also briefly, we can't resist testing using the polls. So I'm going to put a poll out there. And given the fact that we had folks register from 25 nations, I have a quick poll here on how many of the attendees in our session are from the Pittsburgh area and how many are outside. All right, so we'll run that poll while we go around and do our brief introductions. By my squares, Jim Jordan, you're up next, please. I can't hear. Can you hear, Jim?
I had put myself on mute to avoid the lawn mowing noise outside here. My name is Jim Jordan. I'm in Pittsburgh, Pennsylvania. I'm a distinguished service professor with Carnegie Mellon University and the president of a company called Life Sciences Greenhouse, which takes startups from the university out. And the story we'll talk about later is a startup. So my background is I basically have 25 years experience, and I've been doing big companies. So I've been Johnson & Johnson and McKesson and Boston Scientific, and I've done a handful of startups along the way, and I've done a bit of consulting.
Thank you, Jim. Sheillah, could you introduce yourself, please?
Hello, everyone. I'm Sheillah Bagayana Mutetire. I'm the Uganda manager for FREO2, and I'm very excited to be part of the Pittsburgh Product Camp. My background is biomedical engineering, and I'm very excited to share with you some of our stories and innovations that are directly increasing access to oxygen therapy in Uganda.
Thank you, Sheillah. Steve, please.
Yep, thanks, Mike. Hello, everyone. My name is Steve Adudans. I am a medical doctor. I'm the CEO of Hewatel. Hewatel is a social enterprise that focuses on increasing access to affordable, accessible, and safe medical oxygen in Kenya. And now we are going beyond the borders of Kenya. And I'm passionate about saving lives one breath at a time. Glad to be here. Thank you.
Thank you, Steve. Last but not least, Mr. McKenzie from Phillips.
Hey, good morning, everybody. My apologies for being late. I started this at a couple minutes too, and then my IT group decided to push down 25 minutes of updates. So sorry for me being late. So I'm Jim McKenzie. I'm the product manager for Phillips. I manage the global non-invasive ventilation portfolio in the sleep and respiratory care business, and I oversee the innovation, product development, and lifecycle management of 3 portfolios.
Thank you, Jim. So before we start the vignettes, let me just explain that the inspiration for this panel comes from me in terms of that I'm a CEO of a company, LeanMed, which is a medical device company startup, and also a vice chair of the Product Development and Management Association. So being active in both healthcare and innovation inspired me Jim, I think someone mute. Anyway, it inspired me to talk about and bring a panel together about this intersection of healthcare and innovation. So, and I'm fortunate through these activities to know the great people that are on this panel today. So we've heard from Venkadesh. Let's go to Jim. And Jim, if you could give us an update on a particular instance of where you're seeing in your work how innovation is coming to bear in the fight against COVID-19.
So the company I want to talk about is Cytoagents, and I think this company particularly is sort of the reverse, having the reverse experience of what the other companies are talking about. This was a company that was focused on immune pathology, where we have pro-inflammatory cytokines associated with any sort of really immune system response, and it's called a cytokine release syndrome is the issue. And so there's a very much, when you have too much inflammation, you start having issues where you have inflammation going in a wrong direction and causing all sorts of harm, particularly as it relates to your lungs and organs. And so this company has actually finally got funded because of the COVID situation. So they've been able to, they've got data from years going on for SARS and influenza and other things that they've been working on for years, and for all purposes should have been funded for a number of years. And because it was something that wasn't typically in the startup world that would be attractive and promising high immediately hockey stick returns, as we talk about, this company has not had an opportunity to get funded. Now, with this situation, they have been able to get funded and continue their journey. And what's particularly important about this is this drug candidate modulates the body's immune response to reduce tissue damage. And it's not only going to benefit just COVID, it's going to benefit a number of sort of viral kinds of activities. And there's even arguments for, maybe we've heard of people that have had cancer before and maybe even cured their cancer, but later on they had an emergency high, blood count on white blood cells and had health issues later. So this has a wide variety of opportunities and will actually complement whatever therapies we come up with. So why I chose this story specifically is, we think about having oxygen companies that think specifically that can help this. Here's a company that's been around and has phase 2 clinical data and for all intents and purposes should have been funded for phase 3. And because it wasn't attractive enough, it wasn't the latest thing, it didn't get funded. And this has been an opportunity for them to continue on. So that's the company I'd like to share today.
Great. Thank you, Jim. Great story. Sheillah, would you like to go and talk a bit about your experience?
I'll just start by just letting us imagine. So imagine you're blowing into a balloon. You're just blowing air into a balloon. So hold that balloon and just keep it. So when you're not able to breathe, you're able to get air from that balloon and to probably give you air or oxygen. So that's basically what we are doing at FREO2. Because oxygen sources in low resource settings it's been quite a challenge. Even before COVID, many children have pneumonia and they're unable to get an adequate and reliable supply of oxygen. We've developed some low pressure oxygen storage bags, which I would refer to as balloons ideally. So when you switch on the concentrator, you have a bag that can store this oxygen. And when there is no power, patients can still have access to oxygen. And for COVID has really increased the demand for oxygen in very many health facilities. And this system is specifically designed for pediatrics. And we find that we've had to quicken our scale up and plan for scale up because when we have this system in place, then the hospital saves on the number of cylinders which it uses, and the system ideally automatically selects the cheapest source of oxygen to use at a given time. So when there's electricity, the oxygen will come from the concentrator. When electricity goes off, you automatically have oxygen coming from a bag. And then the most expensive source, which is the cylinders, will then later be used if there's a very long power cut. And we found that this then saves on the cylinders. So for COVID, we have to quickly scale up these systems in health center FOs and general hospitals, which we are currently doing now. Our plan is to scale up within the next 2 years to 20 different health facilities. And the reason is because we need to save the cylinders for older patients, and which is also the expensive source of oxygen, while ensuring that our children who are troubled with pneumonia, which is a very high burden disease in Africa, and other neonatal conditions where the child may need oxygen, have access to a reliable source of oxygen even when there is no power. So another thing COVID has done for us is just to increase the awareness and acceptability of new innovations and testing. So it's very easy for hospitals to accept to pilot a system like this in their health facility because of the increased need due to COVID. I think I'll stop here for now.
Thank you. And Sheillah and Steve and I work with a lady living in New York City, Leith Greenslade. And one of the things, a term that's being used now are double burden nations, because our work, many of us started because of pediatric pneumonia and the amount of death to children as a result of pneumonia. Well, now many nations not only still have high rates of pediatric pneumonia, but now COVID-19 comes along. And I think it's around 30 nations, maybe a little more, that are identified as these double burden nations that are fighting both high rates of pediatric pneumonia and COVID-19. So thank you, Sheillah. Jim McKenzie, would you like to give us a little insight into your work, please? You're on mute, Jim, I think. Jim, hello?
Thank you. Yes. So the interesting part about my COVID experience is it starts back in December of last year. So when this outbreak was taking off in China, when they first reported their very first 7 cases, we got an emergency email call and said, please send us everything you have. And literally we sent thousands of ventilators to the country of China to help manage their response to COVID-19. And we turned the plants, we have several manufacturing plants, a high volume and a low volume plant. We spun up both plants to 24-hour shifts, or complete 24/7 shifts, because they weren't normally like that. And then when it became clear that this was going to be a global epidemic, we soon realized that we didn't have a response. Knowing that the number of patients we estimated to need ventilators, to how many were actually could be built by all the manufacturers, we realized there was going to be a massive shortage, which is why you saw the federal government put the Defense Act, Production Act in place. Knowing that this was may take longer than expected, we took a select team. We reached out to the FDA and asked them for if we were going to create a specific ventilator for COVID-19, what would you allow us to do if we were going to create a true medical device to be to give us approval for emergency use authorization? We walked over with the plan was with them. They said, if you can do this, we'll approve it. So we literally started from scratch, I wouldn't say cobbled, but took many things from different products and set in motion that we could build this in our high volume production facility, where we could produce, instead of hundreds of ventilators a day, to literally more than 3,000 a day and up to 5,000 using robots. And so everybody saw lots of ventilators that people were trying to build in like the Ford and General Motors plants and so forth. These were true medical device ventilators. We spun the supply chain up, and then we could really build this. So in 6 weeks' time, we went from, okay, what are we going to do, to a production run where we pulled off 1,000 the very first shift. And so when we submitted this to the FDA, they literally approved our COVID ventilator in 3 days. So they looked at it and they said, this is by far the most achieving success. You literally took something from nothing and built a world-class medical device ventilator that we were able to sell to in the thousands to many countries around the world. So we've sold this everywhere in the Western Hemisphere, Eastern Hemisphere, and in Europe. So from our standpoint, from a product development side, it was probably the most ingenious thing we did in the company, because we said, what is the minimum it takes to treat patients successfully? And that's what we did.
Great. Thank you, Jim. Thank you very much. And Steve, would you like to tell us a bit of a story?
Yeah, yeah. Thanks, Mark. Should I project right now?
Sure. Absolutely.
Okay. Okay.
It may take a second, I think.
Okay. All right.
Yeah.
Has it come? No.
There it goes. Something happened.
Okay. So excellent. So for us, I think this is the thing is oxygen is needed both for emergency and also for therapeutic conditions. And what we have developed is how do we approach oxygen generation, distribution, and utilization through an ecosystem approach for sustainability, because oxygen has been in the list for essential medicines for almost 30 years plus, and was just endorsed in 2017. And but why is oxygen important? There are many cases where oxygen is important, especially touching on women and children. And we cannot forget, as Mark said, many children die because of lack of oxygen. Up to at least 50% of babies die in our facilities because of lack of oxygen. And there comes again a situation with COVID. So more oxygen is needed. So we have developed a system that has been endorsed by UNICEF and even the First Lady of the country in Kenya, where we're addressing three things, and those are access, affordability, and safety for oxygen. How do we do this? We have a process innovation where we're looking at how do we manufacture oxygen using a health system approach at a facility through a public-private partnership model, and we use a universally available system called the pressure swing adsorption system, where oxygen is gotten from the atmosphere, and then we compress this into cylinders, and then using a truck we distribute this using a milkman delivery model to facilities, and this reduces the cost by at least 30% for these facilities. And then to ensure there is adequate utilization, we have the training for healthcare workers. We also have some minimal piping. This is something we've decided is important because of COVID, to ensure that cylinders are not roaming around in the corridors of the facility, and then also ensuring access to pulse oximetry for diagnosis and monitoring of patients who need oxygen. What we see as a unique selling point for Hewatel, and by the way, Hewatel is a Swahili word for plentiful of air. In Swahili, we do not have a word for oxygen, so we chose plentiful of air as a word. So we see this innovation as sustainable and innovative in terms of the public-private partnership model that we have, and also that we have a team approach to everything. But one of the things that we've seen is much more important in sorting out the issue of oxygen is having a supply chain resilience. Because of COVID right now, you cannot afford to have a facility not having oxygen. And we have looked at some of the different models for ensuring accessibility to oxygen. So we even developed now depots. Instead of having a truck going back and forth, to reduce the cost of running the truck, we set up depots that are closer to a facility. This ensures that oxygen is much more available. Human resources, very, very important to ensure that the healthcare workers know how to manage and to operate this oxygen administration, oxygen delivery systems, and especially for COVID-19, how to ensure that oxygen is given in a safe manner. Now, our model is based on a profit model, and therefore for replicability, we look at a 14% value for money investment. So within about 7 years, for those who know the math, one is able to break even and have return on the investment. And the PSA is actually an open source technology, so one can be able to get it. These oxygen plants can last almost 15 years, And because of the partnership model that we have, there is low risk on the capital expenditure for this system that we have. Now the picture here that I have is how the system is. So we have a compressor that abstracts air from gets air into the compressor, which is then dried and then goes through a cold tower, okay, and then an air tank. So the air tank, this is almost medical grade air, and then through the PSA generator, the oxygen is abstracted from the air because there is a substance called zeolite that attaches to nitrogen, which is 78% of the air, and thereafter you have medical oxygen passing through, which is then compressed to cylinders and then distributed. Thank you.
Thank you, Steve. Okay, so we've got a couple of questions in our question queue. And then Steve, if you can stop sharing too when you get a minute.
Okay.
So Michael Hessel is asking, he wanted to know both to Phillips and to Sheillah. So Jim at Phillips and Sheillah with the FREO2 team. Did you encounter supply chain issues when you were trying to ramp up? So either one of you, Jim, you go ahead.
So the reason why we created the EUA product is that the supply chain that we were going after, that was the main decision for creating the product we did, because we had the supply chain in place. Because most other ventilators around the world, the supply chain just isn't in place to make this many ventilators, because these are complex machines made to significant tolerances. So the E30 ventilator that we made, we didn't have supply chain issues, but we've had supply chain issues on every other single ventilator just because of the sheer volume, and manufacturers just aren't geared up to make this level of volume.
Yeah. And Sheillah, did the FREO2, did you encounter any kind of material supply issues in trying to provide these systems?
Yes, we've definitely faced a challenge in the supply chain, especially getting some of the parts, the spare parts for maintaining the concentrators. Some of that has taken us quite a long time to get, and I think really, really huge delays in getting the parts that we need for the systems.
Okay, thank you. We have another question. It's directed at Steve, and it concerns being able to sell your products to African nations when the organizations like UNICEF are considered importing Western designed and built product that can be delivered faster and sometimes cheaper. Is that, I don't want to, I'll let you answer it, but is that a competition, or is that maybe a good thing? But you please go ahead.
Yeah, thanks, Mark. I think it's a good thing, at least because we've managed to be able to also talk to UNICEF and be able to put them on board, because having an innovation that is homegrown enables domestic governments and local organizations to be able to adopt and replicate. So local UNICEF and other multilateral organization representations in the country actually endorse these innovations and these products, and they are able to support how they can be replicated. In fact, our plant that is based in Nairobi, the capital city of Kenya, was actually a co-investment between Grand Challenges Canada and UNICEF in Kenya. So there is some synergies there.
Yeah.
Over.
And if I could add, my personal experience has been the people in this community, first on pediatric pneumonia, now fighting COVID. There's a spirit of, if there's a strong social mission here, and that organizations are open for all solutions and not so much hard competition like in more mature industries or more profit-driven industries. But I think people welcome the support that can come from anywhere. So it's not a zero-sum game. We have a question to Jim McKenzie from Andreas about, will you continue? Well, once your emergency use authorization expires, will Phillips keep that ventilator in the market, or will you simply let it expire when the EUA expires? Will you
We're
take
going
it
to
off?
Yeah, we're going when the EUA is expired or canceled. We're not going to manufacture this ventilator anymore, and the reason for is that the ventilator, the supply chain and so forth is caught up. And I will tell you that I think in the last 9 months, there's been it's kind of a slang thing that we say here at work. There's been more ventilators made in the world in the last 9 months than we believe ever have been made before.
Wow.
So there aren't enough. So we believe there's enough to cover all the issues. Plus, doctors don't need to ventilate patients as much anymore because there are better protocols than just ventilating patients now. That there's some drugs that are actually really working, and then we hopefully won't see it, but we're prepared in case there's a second bump in the COVID cases. We're seeing some of that in Europe right now, but not to the point where we're selling these ventilators yet. This is kind of I would call the E30 kind of a mass casualty ventilator.
Okay. And to build on the supply chain question, Venkadesh, I know in my conversations with you and in my reading as well, I realize in India, there's quite literally a shortage of cylinders, the oxygen cylinders. Can you talk for a moment about that, and how are people responding, again, either in supply chain innovation or product innovation, to be able to bring access, the oxygen access in response to COVID?
Yeah, in case of there are two ways people are coping up with this, and as well as hospitals. One is the oxygen cylinders. In fact, in oxygen cylinders, we are not finding a huge shortage. But in terms of people who want to have this medical concentrators, right? The oxygen concentrators, that was not a kind of normally it was available in hospitals only, but now the people with affluence, they want to buy on their own, right? There are companies came up during this period. They're offering oxygen concentrators for like a home appliance. So now they're renting it out, I would say it is covering the entire cost of this over a period of say 12 months, and people are taking this for their home usage. But in terms of oxygen cylinders per se, we have not seen a huge shortage on this.
Yeah, I think in kind of my reading and conversation with people, I think it's really forcing a lot of nations to look at their supply chains, where critical components are manufactured. So I think it's a consensus almost globally that supply chains will be analyzed and people will be taking a harder look, and that the lowest cost possible will not be the only metric when deciding where something will be manufactured. It's been as everyone knows, I think, on the panel and in the audience, it's been a huge issue, particularly United States, for example, with PPE. We have a question also about what about some of the secondary longer term problems that come with COVID. And Jim Jordan, I think I'll direct this one at you, given the breadth of the work you do at Pittsburgh Life Sciences. I think just to level set here, we know that there's the immediate mortality as a result of COVID, but people are now beginning to understand, and data is beginning to emerge, that there are longer term health issues that come with contracting COVID-19. Do you see anything in that area, Jim, that will be a source of innovation?
I do, and I if I may, I step back for a minute because because I belong to Heinz College, which is public health, and I do startups at the same time. There's a observation from the conversation that we just had that I didn't expect to get, which is really product development, product management is about understanding the whole system, and then from a public policy perspective, public health is a bit of a national defense, right? And the problem with national defense by its very nature, if we paid for it when we needed it, we'd never have time to scale it. And so as I listen to the people here. We have public health people, we have startups. In my story, we have Fortune 500, and how could you not go to Phillips, right? Because that supply chain infrastructure would take years and years to spend. And then I'm listening to Sheillah and Steve talk about what they're doing is they're using this public health crisis to install infrastructure that would last longer. And so I find that incredibly interesting to me in terms of that perspective. And then, Phillips saying when this is done, we'll step back and let people go about their we were there for the crisis. And you can think about the manufacturers we've used in our various World War II and one and other crises we've had around the world. And so that just struck me is really curious here, because that's what product managers think about, right? Is infrastructure and all that, but there's a public health play here. Now, in the case of my example of a company, it's a company that wasn't getting attention, that had it was a startup. It didn't have the funding to be able to deliver something that not only can help in this crisis, but just help in influenza and other areas there. But I think in terms of health systems, it was a great epidemiology article put out talking about the 3 or 4 waves of COVID. And obviously the first one we were talking about here, but the second ones is, people with chronic health issues are not really getting them all taken care of to the level that they should. And those are going to wreak its ugly head. And then there's this conversation of mental health issues after this, as it relates to isolation and communities not connecting and things like that. So I think there's a lot of lessons that are going to come out of this at the end, and we're going to have some infrastructure in place that should have been in place anyways. And so there's some investments that will be made. We'll have some companies like the one I'm talking about that could have helped mankind in a number of subtle ways, but they just weren't maybe sexy enough to get the venture capital startup funding. And so, from that perspective, then we'll focus on, going back and treating our patients with chronic disease. And you think about, the things that Respironics are doing particularly, right? Being able to make sure people are on their sleep apnea machines and gathering that data remotely, and other things that they're working on during this time is really helping on that second wave, that if they weren't gathering that data, making sure people are being compliant or checking in on that, would be a consequence that we'd have in phase 2 or phase 3 of this. It could be quite costly.
Yeah. Steve, did you have something to add? I saw you nodding. I don't know, anything additional about this. And by the way, I think there's 2, if I could clarify, like 2 second orders. One is, what's coming downstream, just in terms of COVID. And maybe I'm reading too much into Jake Meadows' question, because I have a personal friend I went to high school with who contracted COVID. And of course, he had a bad time of it. He survived the respiratory infection, but he's now scared to death that it's done damage to his heart. And I can't read into what Jake was asking. So there's both the infrastructure, but also these other not as prominent, right? We tend to think of it as respiratory failure and immune systems. So Steve, I didn't want to take it. Any thoughts on either downstream second order or these other disease states or chronic disease states that can come as a result of COVID?
Yeah, but I think for me, it's from a community perspective, to a great extent, COVID had what we call COVID collateral, where certain conditions that have suffered because of COVID, maybe children, missing their immunization because there is stigma with the facility because people are dying because of COVID. So some of that collateral on a public health perspective can have major impact in the society, because we're looking at babies or children who have missed the immunization schedule. Later on in life, they can contract a condition, be it TB or meningitis. So that is a challenge we're seeing right now that can happen. The other thing I want to mention is that also COVID has exposed the vulnerable and very soft underbelly of the African healthcare infrastructure, because we never thought that oxygen was really needed at every level of facility before COVID, because originally oxygen was very important, maybe for surgical conditions and maybe critical patients. But now we're looking at patients before they have ventilatory support, they need oxygen. So ensuring that you have oxygen at a low level facility like a health center, it becomes an infrastructural nightmare. And back to James's thoughts. How do you ensure that you have a very, very resilient supply chain that ensures that a drug or medicine like oxygen does not produce injurious outcomes at a lower level facility? You have to do some careful deployment of what I would call vigilance of administration of a drug like that, because you have to ensure it's safely given. Yeah, so in a sense, there's some of those things. But for a number of patients, I think, who have developed, I've seen a number of patients who are saying that it's never the same. There is some element of PTSD for patients who have contracted COVID. They always have this feeling, because that I contracted COVID before, and the return to normalcy is becoming quite of a challenge, because you're constantly wondering if I ever have like a cough, is it another reinfection or something like that? So sometimes there's likely to be a bit more of psychological aftermath for a lot of this for these patients. Yeah, thanks.
Thank you, Steve. I'm going to try to squeeze in one more question. We've got a couple of minutes. This one's directed at Jim McKenzie. JB wanted to know, with the War Powers Act, how did it impact your business model? Can you give us a brief answer on that, Jim?
Yeah, so it's I've never seen anything like that before. Obviously, we haven't seen anything like that in decades. Yeah, right. So what was interesting is that we were able to command companies to come to work for us. So I'll give a good example. Is there is a company in Michigan that makes chassis parts for cars. And one of the problems that we needed to solve was all these ventilators have to sit on a stand or a roll stand, and there's only a couple of companies that do this, that can do it at any scale. So we literally looked at a couple of places, reached out to these people, and they said, we don't make medical equipment, we make car parts. And they said, well, this isn't that difficult. Potentially we could. We sent them the letter from the defense group and said, you're now making roll stands. We're going to send you the plans. And it took them 6 weeks to kind of change their manufacturing line. And they made like 25,000 roll stands in 2 months time, because we were able to just walk in, hand them a piece of paper and say, you have to do this for us. And it was interesting. People will only work one shift, or they weren't working at all. They brought everybody back, spooled everything up, and then they could use our requirements to their other component suppliers too. So it was it's like shooting adrenaline in the supply chain is what it is. It's fascinating to watch.
Great story, Jim. I'm assuming, did you also get to tell them what price they were going to sell it to you for? Did the government let you do that as well?
Were fair. So we were fair about that, because we knew that everything we did was under government scrutiny. So it was one of those ones where we took with the price that we were buying for everybody and said, give us a range within this, and that's what was provided. So so you have to be very careful with those kinds of things.
Well, look, we're at time. It's 11 o'clock Pittsburgh time, 11 a.m. So I want to thank all our terrific panelists. It was a great discussion. It was a pleasure to see all of you a little bit today. And I want to thank our audience for their participation, their insightful questions. Please go out and enjoy the rest of Product Camp, and have a great day, afternoon, or evening. Thank you, everyone.
Take care. Bye.
Yeah, thank you.
Thank you.
Thank you. Goodbye.
Bye-bye.
Sachin. Oh, so we're still we're still backstage if we want. I think. Are we off, Sachin? Or is it a hot mic?